Welcome to the Deep Dive.
Great to be here.
Today we're looking at, well, a really fascinating article. It's published in partnership with Seoul National University Bundang Hospital, and it's all about the future of surgery.
That's right. Specifically, digital twins. How they're being used, how they're being developed. It's pretty cutting-edge stuff for surgical care.
Okay, digital twins. So our mission today is to, strip away the complex language. What is a surgical digital twin? Let's explain that simply and look at the potential.
Right. So imagine you have a virtual copy of a patient, but it's not just a static picture. It's a dynamic replica of their physical state, their physiology.
Dynamic how?
It constantly integrates new data, scans, lab results, maybe even real-time monitoring from during the surgery itself, and it updates to mirror what's actually happening with the patient.
Okay, like a living simulation of the patient that changes as they change.
Exactly. And the point of it, the value, is huge. Surgeons can use it for training, for planning really complex operations, for making critical decisions during surgery, and even for predicting how things might turn out.
That does sound like a big step up. The article mentions this isn't entirely new territory, right?
Yeah.
It builds on things like CAS and VR.
Yeah, it's definitely an evolution. We had computer-assisted surgery, CAS, maybe helping guide instruments based on scans taken before the operation.
Okay.
And virtual reality, VR, great for training in simulated spaces. But these digital twins, especially when you layer in augmented reality, AR,
remind us.
augmented reality, where you overlay digital information onto your view of the real world. So these new digital twins combined with AR, they're much more sophisticated. They're not just static models. They're these dynamic replicas that learn and predict.
Interesting. The source mentions different levels of these twins. Can you break those down for us?
Sure. The article lays out 4 levels, kind of increasing in complexity. First up is the static twin.
Okay.
Think of this as a fixed 3D model. Based on scans from one point in time, its main use is visualizing complex anatomy, like for planning.
Like a highly detailed 3D map of a specific part of the body.
Exactly. The article gives a great example. Using a 3D printed model, which is essentially a physical static twin, to plan out the incredibly delicate surgery to separate conjoined twins.
Wow.
It lets surgeons see everything, plan cuts, practice, all before the actual operation. Also really useful for explaining things to patients.
Makes sense. What's next?
Then you have functional twins. These add another layer. They don't just show the shape, they incorporate how tissues might behave, like their mechanical properties, or how fluids flow.
Ah, so you can simulate an action.
Precisely. You can simulate an intervention and see how the virtual tissues might react. Adds predictive power to planning. Moving on up, shadow twins. These take that functional model and feed it real-time data from the patient during the actual surgery.
Okay, so it's updating live.
Yeah, like a live feed, constantly refining the virtual replica. The surgeon sees changes as they happen. And the top level, intelligent twins. These use the Shadow Twin Foundation but add artificial intelligence, AI, and machine learning.
Ah, the AI element.
Right. And their big thing is prediction. They analyze the incoming data to predict outcomes, flag potential risks, maybe even suggest the best way forward.
That sounds game-changing. Are there concrete examples of these intelligent twins in action?
Yes, the article mentions a couple. One is called cardiovision. For aortic stenosis patients, it looks at calcification patterns on scans using AI to predict the risk of problems during surgery and can even suggest which surgical technique might be best.
Incredible.
Another example is in liver tumor ablation that's using heat to destroy tumors. An intelligent twin could predict in real time how the heat is spreading, helping the surgeon be precise and avoid damaging healthy tissue nearby.
So it's going beyond just showing information. It's actively guiding decisions based on what it predicts.
That's the goal, yes. And you see these different twin types being used all through the surgical journey. Static twins for planning and basic training, functional twins for simulating procedures. Shadow twins, especially with AR overlays, showing information right onto the surgeon's view, providing guidance during the operation itself, like in complex skull or spine surgeries mentioned in the article.
The overall potential really seems enormous then. What's the big picture takeaway for the source?
Well, the article really emphasizes how this could transform surgery, making it much more personalized, more adaptive, because it uses real-time data and just fundamentally data-driven. It's about giving surgeons, enhanced awareness and precision.
Sounds amazing, but I have to ask, are there hurdles, challenges?
Oh, absolutely. And the article acknowledges them. Things like data, you need vast amounts of high-quality, unbiased data. That's a challenge. and developing standards, ways to properly build and check or validate these complex models. Plus, just the practical side cost, getting hospitals to adopt this, fitting it into how they already work. These are big areas that need work.
So pulling this together for our listeners, what's the core message?
I think the core idea is that these surgical digital twins are evolving incredibly fast. They started as static maps, but now they're becoming these dynamic, intelligent systems that don't just simulate, but actively assist throughout the whole surgical process.
And for someone listening, maybe thinking about future medical care.
For you, this means that surgery in the future could be significantly more tailored to your specific body, more precise. It's taking patient-specific care to a whole new level.
Which leads to a really interesting thought, building on what the article implies. As these digital copies get more and more sophisticated, almost becoming these perfect virtual counterparts that can predict how our bodies will react, how might that change the whole dynamic? The relationship between the surgeon, the patient, and this incredibly powerful digital double right there in the room.
Yeah, that's definitely something to think about. A fundamental shift, potentially.